Hi everyone. I wanted to give you guys a little rundown about the training that I went to over the weekend. It is called TBRI, or Trust-Based Relational Intervention. And it ended up being a great training that I wanted to share with you guys, especially because of the trauma training from Dr. Stephanie Grant on Friday. This kind of piggybacks right off of that trauma training. And so I think with the deeper understanding that everyone is kind of developing from the trauma training and just trying to be more trauma informed, this kind of goes right along with it and provides some more strategies to kind of help us when working with kiddos who have trauma experience, or who have experienced trauma, I should say, in their lives. So as I'm going through this, I think it's beneficial to just kind of pick out one or two students who you can think of in your classroom or that you work with every day to maybe try keeping some of these strategies in the back of your mind throughout your day when working with that student or those students. So I've attached the PowerPoint as well, so I'm just going to kind of go through it. I have my notes in front of me, so I'm not going to be making as much eye contact with the camera, but I'm going to do my best. Okay, so TBRI, there's three main principles when it comes to this intervention. The first one is empowering, the second one is connecting, and then the third one is correcting. And most of the time, we are wanting to know, well, what can we do to correct their behavior? But it is crucial that we start with the empowering principle and then add in the connecting principle. And then, of course, there's going to be times where we need to correct behavior, and so then adding that in as well. But the heart of TBRI is the connection principle, and that's kind of the core of it. Okay, so why TBRI? Well, traditional discipline does not work with kids who have experienced trauma in their past. And punishment is the least effective way of changing behavior with these kiddos. So what can we do? Well, that is a big why behind the TBRI approach. Only responding to behavior will push those kids into that fight, flight, or freeze. And obviously we want to try to avoid that at all costs. So only responding to that behavior and nothing else, that's what's most likely going to happen. So we want to avoid that. So the typical child, this is not the child that we're talking about with this intervention. The typical child might respond to more of our typical approaches to behavior, like PBIS and that positive reinforcement. But the typical child is not what we're talking about with TBRI. So this was a disclaimer that they talked about, that TBRI is not a quick fix. She talked about how when she works with her foster kids with TBRI, it takes days and weeks and months before she sees a change. So this is not a quick fix. This is an investment into this kiddo and to help this kiddo feel safe. She also talked about how it needs to be repetitive and how this TBRI isn't just a one and done, that it involves a lot of repetition. Like I said, every day for weeks and for months. There was one quote that I wanted to read. I'm not going to go into, they did talk about like what is trauma, how does it occur, but you guys all kind of have that base of knowledge from Dr. Stephanie Grant. So I'm going to kind of skip through that, but there is one quote that I want to read. It's about toxic stress. And it's a quote by Perry, and it says, "A confident, well-regulated adult can take a child out of a fire and have less trauma than an anxious, dysregulated adult conveying fear to a child who falls off his bike." So that really hits home in terms of making sure that we always stay calm in those high stress situations, because it's important that, especially with a kiddo who's experienced trauma, they need to have a regulated adult to help them feel safe. So if we come across or convey our dysregulation to these kids, then they're not going to feel safe, and then that's where we see the fight, flight, or freeze. So just something to keep in the back of our mind. Another thing that I just wanted to kind of highlight is that a lot of these kiddos, they feel at fault. So if they are doing well with something, lots of times you will see them sabotage it. They'll often try to prove that they're bad. It could be with academics or it could be with behavior. And then that's where you kind of have like the conflicting messages in terms of like, I love you and I want to be around you, but I also hate you and I don't want anything to do with you. A lot of that self-sabotage we see. Okay, so kind of diving into those three principles, the empowering, the connecting, and the correcting. So the empowering principle really sets all of this up for success. The empowering principle, it starts with their basic needs. So do they have food and water at least every 2 hours? Kids who have experienced trauma, they often have pretty high blood sugar shifts. And so it's important that they always have access to food and water, along with adequate sleep. That's a great reminder for parents. They often expend so much energy in that alarm state that Dr. Stephanie Grant has talked about. So much energy has been expended, so they have got to recover and get that sleep. Of course, it's out of our control lots of time, but just something to talk with parents about. But the food and water as a basic need, that is something that we can do on our end at school. Regulation. So sometimes we hear the term, how is your engine running? And kind of thinking of the zones of regulation. They need help regulating. So we can't just expect these kids to regulate on their own at first. They need to know that there is a safe adult who can help them regulate and will regulate for them. And then it kind of leads into the co-regulation where you guys can regulate together and they can feel safe doing that with you. And then eventually they'll be able to do it independently. But that's, like I said, way down the road. Going back to the basic needs with the food and water, all of that helps them feel safe. It creates this environment of safety. Another thing for empowering principles, creating predictability. And there's going to be times in your classrooms where there's going to be a shift, there's going to be a change, that's inevitable. But creating structure around the unpredictability. There's going to be times where things come up and things happen, but creating some sort of structure around that, some sort of heads up, some sort of visual, whatever it is, but creating that structure around the unpredictability. This is something that I see a lot of sensory needs and movement every 2 hours. There's a lot of sensory and movement breaks going on in our classrooms, so that is great. Sharing the power. This was a big one that they touched on, sharing the power. So sharing that sense of control. We don't always need to be in control, and sometimes it can feel like we're losing this battle if we share that power. And I'll come back to this topic in a little bit, but sharing the power is very important for these kiddos. Moving on to connecting principles. Again, this is the core of TBRI. So this is where we should focus most of our attention, is on the connection. And lots of these kids, they missed out on connection as an infant or as a toddler, and so it's important that we try to build this connection and keep this connection with these kids throughout any high stress or crisis situation, that we always need to come back to that connection. A point on here is that it's hard to connect with fear. So the importance of connection, but these kids live in a constant state of fear, and it's difficult to connect with that. We've seen those kids that it's difficult to find that connection with or build that connection with, that relationship. And so being playful disarms fear. So that was a point that they brought up, that the more that, and on the PowerPoint it says play disarms fear, but she just said just being playful with the kids and not always having to be so serious or being so rigid about things. Just having a playful tone of voice and body language and things like that will help disarm that fear and allow them to connect. Affection is on here for a connecting principle. That doesn't just mean hugs. It could be just how you talk to them, getting to know them, showing that you care. Of course, it can be the hugs and the high fives and the fist bumps and all of that, but it can go way beyond that as well. Sticking together. So it's difficult to make a connection if you're not close. So these are kids that you just might want to keep closer to you. Maybe these are the kids that you put near the front of the room or near your desk, or maybe you just make a point to check in with them, just keeping them close. Another principle in terms of connecting is being approachable. So not only does that include your voice and your body language, but facial expressions. They can read your facial expressions from a mile away. And sometimes you might not even be upset about something, but if you don't have a smile on your face, then they think that you are mad at them and will try to sabotage whatever situation it is. So being very mindful of our facial expression, our body language, how we carry ourselves. Eye contact is another way to connect with these kids. So coming down into the child's field of vision, getting down on their level, not talking down to them, but being on their field of plane. And giving prompts to maybe help remind them, not only when you are correcting their behavior, but just, giving them prompts to make eye contact, even just when you're having a conversation, to build that connection. Let's see, going on with connecting principles, having matching affect. So if they come up to you and they're really sad about something and they're talking in a really low, sad voice, obviously trying to match their affect and match their tone of voice with, oh man, buddy, that's, I hear that you're feeling sad and I'm really sorry about that. And kind of just matching their tone and matching their affect. And praise, that's another way to connect. So praising who they are, their character. Normally I always hear the 4 to 1. They recommend 6 to 1 for these kids with trauma. And making sure that it's specific. So not just good job, buddy, but very specific praise. Even in the middle of a tantrum. Even when they are melting down and yelling, and so if they yell out, "I'm so mad," wow, good job using your words. Thank you for telling us that you're mad. So any sort of praise that we can give these kids is a win. Giving voice to the students. So again, that kind of goes back to sharing the power, but encouraging them to use their words. And sometimes you might have to give them the words. Sometimes we might speak for them, and that might just be good enough. For that time, but encouraging them to use their words, to give their words. And when a student's voice, when they voice a need, so I have to go to the bathroom, I need a drink of water, whatever their need is at the time, do everything in your power to meet it. It might not be the best time. It might not be a time where you would normally allow some of these things to happen. But if we can pinpoint some of these kids where TBRI can be effective, do anything you can to meet their need. They're not, most of the time, being manipulative in any sense. It is just a need. And when that need is met, then they feel safe and you're able to connect with them. All right, the last slide for connecting principles. Acknowledge and accept all of their feelings. So lots of times this happens. So acknowledging all of their feelings, even if it's not true. So for example, if they're yelling out, "You hate me, no one here likes me," instead of saying, "Yes, we do," and having that argument in that moment, that won't help this situation with this kid. Just acknowledge it. Yup, I hear you say that, you hate us. Yup, I can hear you say that. Or yes, I can really tell by your body language that you're upset, or whatever it is. Just acknowledge it, accept it, but arguing back in that moment with, "Oh yes, we all love you," or "Of course we all care, that's why we're here," it's not going to help with these kids in that moment. And that's something too that they talked about, connecting and coming back to that situation or that conversation when the student is more calm and more regulated, and having that conversation about all the people that do care about them, or whatever the situation or the words may be that they have used with you. with connecting, giving space when they're requesting it. So not just giving space when we need it, but giving space when they're requesting it or when their body language is showing us that they need space. Just kind of acknowledging that and giving them the space that they may need at that time. And it could be physical space, it could just be verbal space that they don't want to be talked to right then. And allow them to say no. And so obviously it's not, they're not saying allow them to say no if you ask them to, like, let's say, do a chore at home. They can't, it's not that we're allowing them to say no, but giving some of that control and some of those, like a little bit more leeway. And maybe it's no right now, or maybe you just kind of have them do half of whatever you're asking. And we're going to get into compromise too with the correcting principles. So the next slide is the correcting principles. So we've talked about how can we empower them and kind of set them up for success, and then the connecting part of it, which is the core of it, which will help build the relationship. So then the correcting principles will be effective. They'll be much more effective if you have that connection and relationship with the student. So the correcting principles, provide choices. So, it can be a visual, like you can choose this, or you can choose this, or a visual with your hands out. And that way they can just point because much times it's easier for kids to point to a visual than to actually use their words. And if they point, or even if they look at one or the other, acknowledge it and reinforce it and let them have that choice. Compromising. So going back to letting go of some of that control. It's okay to not have that full control in that situation. They talked a lot about redos. So think about it kind of like practicing and reteaching that we already do for PBIS. It creates that motor memory for the wanted behavior. And you may need to give wanted words or actions. You may need to give them the words that you would like them to use in the redo. And they also talked about having the redo in the location of the crime. So going back to that spot and having them redo as authentic as possible, and making sure that your tone of voice is matching their level. So if they're being respectful and they're redoing it with you, then you are being playful and respectful in return. It just needs to be as authentic as possible. They also talked about, for a correcting principle, using scripts. So these are short phrases that have great meaning. We want it to be short, so we're avoiding the lecturing. We don't want to lecture when we are correcting behavior. We want it to be short, and we want it to have meaning and have a quick response. So for example, use your words, gentle hands, whatever it is, we want it to hit a lot of different situations, making sure that these are pre-planned things that you can say. And let's see, so then with repetition, making sure that you're practicing when you are calm and the student is regulated. And practice and have them repeat lots of different strategies. So not just the redos, but any strategy that you feel like they may need practice with, have them do that and have it not be a consequence, but have it be something quick that you do to help them practice when they are calm. The next correcting item is setting the bar. So for some of our kids who have a really hard time regulating, we might set the bar really low for them, and that just might be good enough for that day or that time or that week or for the year. They just might have a really low bar. For other kids, more typical kids, their bar might be higher. Kids that we know that they can do these things and they're able to self-regulate. But for a lot of our trauma kiddos, the bar is going to be lower. So making sure that we set the bar, but the bar is not set too high because we want to set them up for success. Because when they feel success, they're more likely to try it again. But when they don't feel success, they're more likely to give up. So making sure that we are setting the bar, but not too high. We want them to feel successful or they will quit trying. The last bullet point on there is balancing structure and nurture. So obviously with increase of behavior, we're going to increase structure. However, we also need to increase the nurture. So TBRI states that we need a balance of both. We absolutely need structure. You need structure for the typical kid, but we need increased structure for our trauma kiddos, and then which also comes with an increase of nurture and providing that connection. So making sure that we have a good balance of those. Something to remember with that, we are the coach. Okay, we are coaches in the school. We are not the warden. Okay, so thinking back to compromising and things like that, making sure that we are coaching these kids on the skills that they need and the strategies that they need. We are not the warden, and we shouldn't expect them to do it, the right way or the way that we expect them to do it every time, or the first time or the third time or the seventh time or whatever it is. These kiddos need a lot of repetition. Something else that they talked about here was doing a time in instead of time outs. So keeping them closer to you when they're having a hard time. So we're going to calm down together. Instead of that separation, the connection and having them close is actually going to be way more effective with these kids than putting them in a timeout. So even if it's having them come sit on your lap, that's a time in. Obviously for our younger kiddos who might just need that during story time or whatever it is. Obviously not so much with our upper L or kiddos that you don't have that connection with, but some of our younger students who just need that extra time in or the extra closeness to help them regulate. Okay, so then putting it all into action. So we have the three principles. We have the empowering, we have the connecting, and we have the correcting, and then putting it all together. So they talked about the ideal response. We want it to be immediate. So within 3 seconds, you want to be able to respond or correct a behavior. You want it to be direct. So you want it to be face-to-face, not across the room. These kiddos, it makes a huge impact whether you're doing it across the room or whether you're doing it in face-to-face. So if it needs to be immediate within 3 seconds, that's about an arm's length away. So keeping those kids close and having a close proximity with those kids. So we have immediate, direct, efficient. So efficient with the least amount of firmness and words. So if we can, kind of going back to the script, if we can just correct it with a short script that is already pre-planned, that would be the most efficient. A is action-based. So again, giving them opportunities to practice or redo. And then even when they are calm, having them practice, like I was saying. And then leveled at the behavior, not at the child. So remembering, saying like, okay, so that behavior was not okay, but you are still a good child. So always going back to the behavior. The behavior was not acceptable, and the behavior is not okay, but you are still a good kid. So it's not their feelings that are the problem, but the behavior. So it's not that they were feeling mad. It's not that they were feeling anxious about something. It was the behavior that came from that feeling. So acknowledging that feeling was okay, that behavior was not okay. So making sure that it's leveled at the behavior. So that is ideal. They also talked about levels of response. And so there's 4 levels of responses of how we should be responding to these kids with a trauma history. The first one is playful engagement. And so this is when a child just has a low level behavior. They're still connected to the adult. They have that flexible thinking, their ability to control and regulate their body. It's all there. The adult, if you need to redirect, you're still using a playful tone, a light tone, your body language and your facial expressions and your tone of voice, is all pretty playful. Use humor. This is when you use scripts. You can do the redos. But with the levels of responses, we really want to identify the level of risk and danger and then respond appropriately. So the first is playful engagement, and that's how most of our interactions with our kids should be, is this playful, it's a low level behavior. If the playful redirection did not work, that is when we go into the structured engagement. So the child in this form of correction still needs to be emotionally present. So can't be escalated too much. They can be upset and angry, but not so angry where they can't think. The adult, the tone is going to be more authoritative. The volume might be a little louder, but make sure that we speak a little more slowly, because when they're agitated, they're not as likely to pick up what is being said to them. So making sure that we are slow down. And this is where we can use those choices and compromises, is when we start to see this more of the anger from the child. And this is where we still want to try to gain compliance and then go back to regulating. If the structured engagement is not successful, then there's the calming engagement. So the connection to the adult is weaker. Maybe they're trying to push away. They're losing the ability to regulate. So this is when, like on the engine, they might start to lose some of that control. The adult must stay focused and must stay calm. Regardless of where we are, our facial expressions say it all. Our tone of voice says it all. So we really have to stay calm in these situations, and we need to be clear. So again, being efficient and having it be short and calm. Simplify the goals. Okay, so if we want them to come out into the hallway and, sit crisscross for 5 minutes and they're not compliant, maybe we just shorten or simplify the goal. We want you to come into the hallway, or whatever it is. Just kind of modify it. Again, lower the bar. Speak slow and use very few words in this calming engagement stage. Your volume is going to be louder, but not too loud that it may trigger the child and then cause that fear response. So it is kind of a fine line between making sure that you are firm and your voice is loud, but it's not overbearing too loud where it's going to trigger that child. In the calming engagement, co-regulating is very important, and that will help them. So letting them know that you are here. But if they need that space, say, okay, I will give you that space. This is where I'm going to be, and I will come back to you to see if you're calm. So kind of helping them regulate. In this stage, the adult, you might feel like you're starting to lose some control as well. And that's where we always need to bring it back to making sure that we stay calm even in these situations. Okay, so if that doesn't work, that's when we go to the protective engagement. And that's when the child is no longer in control. They're violent or aggressive. That is when we are throwing things at other kids. They're trying to hurt themselves. The goal for the adult is to stop the violence and maintain safety, setting the clear boundaries for acceptable behavior and bringing the child back to a more regulated state, of course, would be the end goal. But this is beyond compliance. So when they're at this state, we are not looking for compliance. We are just looking to maintain safety and just trying to keep them safe and the other students safe. This is when a team may be called to help with the de-escalation. That doesn't mean that we are going to go into a hold or do some of the CPI physical interventions, but this is when a team can be called to kind of help de-escalate. So just because a team is called doesn't mean that there has to be a physical intervention. It just means that someone who is on that team can maybe help de-escalate. So that's kind of the basis, and there's a few takeaways that I'm going to try to get in the next minute and 30 seconds. So almost always enforce a redo. So it's very important that the child goes back to the spot of the crime or the place of the crime, and they do that redo with respect. They are calm, and of course lowering the bar as needed. And when they show respectful compliance and connectedness, then move on. So you always want to regain that connection. So if there was an issue with a student and they had to leave your classroom, making sure that when that student comes back to your classroom, you are making that connection again with that student. They might have in the office or with a para or whoever made a connection with them again and been able to calm down, but it's important that that student makes a connection with you again as well. Don't focus on staying in control, rather focus on staying connected. That is why the connected piece of TBRI is the most important. So always making sure that you come back to that connection, because there are going to be times where we lose it. We lose that connection with that student. And remember that when it's over, it's over. So we don't always need to come back to it. If the student left your room and it was dealt with in the office or with a parent or whatever, if that student is going to apologize, then they're going to apologize. But if it's all said and done and it's over, then there's no need to bring that behavior up again. When it's over, it's over. And then just trying to make that connection again. There was a question that came up and said, well, there's just not enough time to work through an issue this in depth with a student. And the speaker's response was, but did you have enough time for the 30-minute meltdown that happened because we weren't using these techniques and we weren't keeping these things in the back of our mind? So I think it's very important to remember that short term, we might not see the immediate benefits of TBRI, but it's incredibly beneficial long term and in the long run. And maybe these are, you might not see it all for the rest of the school year, but next year with their teacher, they're going to be one step closer to being able to regulate and show some of that compliance and more of that respect. But it takes an army, and I think we all do a really nice job with lots of these techniques. But with TBRI, the focus is on connection. So taking that time to connect with these students who need it most, and that you're going to reap the most benefits by connecting with these kids and taking that time up front to connect with them. And that will help in the long term when it is time to correct their behavior. The pushback won't be as much. They'll definitely more likely to comply with someone who they feel connected with. So I have attached the PowerPoint. Let me know if you have any more questions or you want to go more in depth about something. Hopefully you got something out of this video. It was a really great training this weekend, and I enjoyed it very much. Again, this is something that can be used in the schools, but also at home, and especially with these kids who have experienced trauma. So let me know if you have any questions. Thank you so much for listening.